There are at least 7 separate Medicare programs, safeguards and rules currently in place that can reduce, cover, or completely eliminate costs many seniors pay month after month. 7. And before I go any further, I want to correct the biggest misconception on this topic, because it's the exact reason so many eligible people never bother applying. Many people believe Medicare assistance only exists for someone with zero savings, no pension, and almost no income. So if your house is paid off, you get a retirement check, or you have funds sitting in a bank account, you assume none of this applies to you. Another group believes that because they already have a Medicare Advantage plan, every available benefit has already been automatically applied, so they never look into it further. And a third group notices the Medicare premium coming out of their Social Security deposit each month and assumes that figure is permanently locked in. They assume no program, application, appeal, or adjustment could ever bring it down. All three groups can be mistaken because Medicare isn't a single flat bill. It's a combination of premiums, deductibles, copays, coinsurance, drug costs, penalties, and uncovered charges. Each one operates under its own rules, and each may have a different program designed to help with it. One program might cover your monthly Part B premium, another might reduce what you spend on prescriptions, another might legally protect you from certain doctor charges, another might help correct a penalty based on incomplete records, and another gives you the right to challenge a claim your plan refused to pay. The problem is that no one automatically sits down with every American turning 65 to walk through all 7. You have to know these programs exist, know what to ask, and know who to contact. So in this video, I'll walk you through 7 Medicare expenses you may be able to lower, avoid, or eliminate entirely. I'll cover who each one helps, the common mistake people make, and the exact question to ask. Stick around for number 2 because it involves charges. Some Medicare beneficiaries are legally shielded from paying, even when the bill looks entirely official. And stay through number 7, because an initial denial from Medicare or your plan doesn't always mean the debt is final. Let's begin with the deduction most people notice every month. Cost number 1, your monthly Medicare Part B premium. In 2026, the standard Medicare Part B premium sits at $22.90 per month. For many people, this amount is withdrawn directly from their Social Security payment before it ever reaches their bank account. Most people see that deduction and assume it's untouchable, but every state operates Medicare Savings Programs that can help qualifying beneficiaries cover Medicare expenses. There are 4 primary programs: QMB, SLMB, QI, and QDWI. Depending on which one you're eligible for, your state may help cover your Part A premium, your Part B premium, or additional cost sharing. This is where the first expensive mistake tends to happen. People ask whether they qualify for Medicaid. They're told no. Then they assume that automatically rules out any Medicare assistance. But Medicaid eligibility and Medicare Savings Program eligibility aren't identical questions. Some states apply more generous income or asset limits. Some states exclude certain income or resources that people wouldn't expect, and these thresholds can shift over time. So don't disqualify yourself based on an outdated article, a number from a different state, or something a friend mentioned years back. Here's precisely what to do. Contact your state Medicaid office or your local state health insurance assistance program, commonly known as SHIP, and say, "Please screen me for every Medicare Savings Program my state offers, including QMB, SLMB, QI, and QDWI." Use the exact phrase Medicare Savings Program. Don't limit your question to full Medicaid eligibility. If you're approved for one of these programs, the assistance may begin with your premium deduction from Social Security. Depending on which program applies, the help could extend even further. Now let's move to a protection most people have never had explained clearly. Cost number 2. Doctor bills you may be legally exempt from paying. The Qualified Medicare Beneficiary Program, known as QMB, is one of the 4 Medicare Savings Programs. QMB isn't just a small discount or coupon. If you're enrolled in QMB, healthcare providers are generally barred from billing you for Medicare-covered deductibles, coinsurance, and copayments, though incorrect charges can still appear. A doctor's billing system might generate a charge automatically. A hospital might mail a statement. A collection notice might look official and urgent. And many older adults pay immediately because they assume receiving a bill means they legally owe it. That's the mistake. Consider a woman named Carol. Carol has Medicare and is enrolled in QMB, but she never fully grasped what that protection actually covers. After an outpatient procedure, she receives a bill for several $100s marked patient responsibility. It lists the doctor's name, the service date, an account number, and a late payment warning. Carol pays it because she doesn't want it sent to collections. But before paying, Carol should have reached out to the provider and said, "I'm enrolled in the Qualified Medicare Beneficiary Program. Please verify whether QMB billing protections prohibit this charge." If you have QMB, keep your enrollment proof somewhere accessible. If a provider bills you for Medicare-covered cost sharing, reach out to the provider's billing office and your Medicare plan before submitting payment. Not every medical charge is protected. Services Medicare excludes, elective procedures, and other non-covered charges may still fall on you. But the broader point remains. An official-looking bill isn't proof by itself that you're legally required to pay the listed amount. If you're enrolled in QMB, verify first. Cost number 3. Part D premiums, deductibles, and prescription copays. The third program is called Extra Help. Extra Help is a federal program that supports eligible Medicare beneficiaries with the expense of Medicare Part D prescription coverage. In 2026, individuals receiving full Extra Help can have a $0 premium and a $0 deductible under an eligible drug plan. Co-payments for covered medications are also capped. The official 2026 caps list co-payments as high as $5.10 for a generic covered drug and up to $12.65 for a covered brand name drug. Depending on individual circumstances, some people receive Extra Help automatically because they already receive Medicaid, supplemental security income, or support through a Medicare Savings Program. Other people must submit an application, and that's where thousands miss out. They assume that if no one reached out, they must be ineligible, or they applied years earlier, were denied, and never reapplied after their income, savings, marital status, or household situation shifted. Another mistake can occur even after someone is approved for Extra Help. Not every Part D plan carries the same premium. Extra Help may fully cover the premium for certain qualifying plans, but if you remain enrolled in a costlier plan, you may still owe the difference. So qualifying for Extra Help is only the first step. The second is whether your current plan is structured to maximize that benefit. Contact Social Security, Medicare, or your SHIP counselor and ask, "Do I qualify for Extra Help? And would switching Part D plans allow Extra Help to cover more of my premium and prescription costs?" Don't switch plans without thinking it through. Your medications, pharmacy, formulary, and prior authorization requirements all matter. But don't assume your current cost is automatically the lowest one available. Cost number 4. Prescription expenses once you hit the annual cap. In 2026, Medicare Part D enrollees face an annual out-of-pocket limit of $2,100 for covered Part D medications. Once your qualifying out-of-pocket spending reaches that limit, you owe no further copayment or coinsurance for covered Part D drugs for the remainder of that calendar year. But 2 points of confusion tend to arise. First, the cap applies only to drugs covered under your Part D plan. It doesn't mean every medication, supplement, medical product, or excluded drug becomes free. Second, the Medicare Prescription Payment Plan is not the same thing as this annual spending limit. The payment plan divides prescription costs into monthly installments rather than one lump sum at the pharmacy. That may ease your cash flow, but it doesn't reduce the overall cost by itself. Consider a man named Frank. Frank fills a costly prescription in January and receives a steep pharmacy bill. He enrolls in the Medicare Prescription Payment Plan and assumes his medication became cheaper. It didn't. The plan simply spread out what he already owed across several monthly payments. The separate $2,100 annual Part D out-of-pocket limit is what eventually halts new qualifying charges for covered Part D drugs once that threshold is met. Contact your Part D or Medicare Advantage drug plan and ask, how much qualifying out-of-pocket spending have I accumulated toward the 2026 Part D cap, and which prescriptions count toward it? Then ask, would the Medicare Prescription Payment Plan help spread out my costs, and what would my estimated monthly payments look like? One protection limits your yearly expenses. The other simply changes the timing of your payments. Know the difference. Cost number 5, paying for preventive care. Medicare may already cover for free. Medicare. Part B covers a wide range of preventive services intended to catch health issues early or prevent them altogether. For most covered preventive services, you owe nothing when the service is provided by a provider who accepts Medicare assignment and all coverage conditions are satisfied. But the term preventive creates one of the most frequent billing surprises. A preventive visit and a visit to diagnose or treat a new medical concern aren't always handled the same way. Picture Susan scheduling her Medicare annual wellness visit. During the appointment, she asks her doctor to examine new shoulder pain, review a worsening skin issue, and adjust one of her medications. The wellness visit itself may carry no cost sharing, but addressing those additional new concerns may be billed as a separate, medically necessary service, subject to the usual Part B deductible or coinsurance. Susan sees the resulting bill and assumes there's been an office error because she scheduled what she thought was a free Medicare visit. The charge may be entirely accurate, but it shouldn't have caught her off guard. Before your preventive appointment, ask, is this being scheduled as my Medicare annual wellness visit? Then ask, could discussing or treating any additional health concerns today lead to a separate charge? You're not declining care. You're simply clarifying the billing structure beforehand. Also confirm the provider accepts Medicare assignment and that the preventive service falls within the interval Medicare covers. The takeaway isn't that every preventive visit is free under all circumstances. It's that many covered preventive services carry no cost sharing when requirements are met, and you should understand which portion of your visit Medicare classifies as preventive. Cost number 6, late enrollment penalties that may be worth reviewing. Medicare late enrollment penalties can follow someone for years. For Medicare Part B, the penalty typically raises the premium by 10% for each full 12-month period a person could have enrolled but didn't, unless an exception or special enrollment period applies. In 2026, with the standard Part B premium at $22.90, even a percentage-based penalty can add up to a meaningful recurring cost. Medicare Part D calculates penalties differently. The Part D penalty generally equals 1% of the national base beneficiary premium, multiplied by the number of full months a person went without creditable prescription coverage while eligible for Part D. The 2026 national base beneficiary premium used in that calculation is $38.99. These penalties are genuine, and no one should deliberately disregard Medicare enrollment deadlines. But the mistake lies in assuming every penalty calculation is based on complete and accurate records. People retire at different ages. Some keep coverage through an employer plan, some are covered through a working spouse. Others carry retiree coverage or COBRA and mistakenly believe it grants the same Medicare enrollment rights as coverage tied to active employment. These rules can differ substantially. For instance, COBRA generally doesn't provide the same Part B special enrollment period that active employer group coverage offers. If you're being charged a penalty and believe you had qualifying coverage, don't simply ask, "Why is my premium so high?" Ask instead, "Which exact months does Medicare say I was eligible but lacked qualifying coverage?" Then ask, "What documentation can I provide to prove the coverage I had during those months?" For Part D, request confirmation from your previous insurer about whether your prescription coverage counted as creditable. For Part B, collect your employer coverage records and confirm whether that coverage was tied to current employment. A penalty shouldn't be disputed simply because it's costly. It should be disputed when Medicare's coverage record is incomplete or inaccurate. Now we arrive at the final cost, and this one could outweigh everything else on this list combined. Cost number 7, paying a bill after Medicare or your plan denies it. A denial isn't necessarily the last word. Original Medicare, Medicare Advantage plans, and Medicare Part D drug plans all maintain formal appeal procedures. The specific process depends on which type of Medicare coverage you have and what decision you're contesting. But the costly mistake is nearly always identical. Someone receives a denial notice. I read every comment because they help me decide which Medicare rule deserves its own dedicated video next. Take care of yourselves. Take care of your health. Subscribe to the Benefits Bench channel for more valuable content.